Well, California has decided to expand Medi-Cal, full-scope Medi-Cal coverage, which is health insurance. That's our safety net health insurance program for low-income people. California has decided to expand that to all individuals who are in the country without legal documentation. So all illegal immigrants or undocumented immigrants in California can sign up for full health insurance if they are income qualified. What's happening is this is costing the taxpayers of California quite a lot. Normally, Medi-Cal is paid for in a partnership, the state and the federal government. But federal law does not allow health care benefits or any benefits to be paid to people who are in the country illegally. California has passed a number of laws that expand this coverage. It's 100% paid for by California taxpayers, and there are no limitations. In other states, and previously in California, people who were in the country without documentation were entitled to emergency care and pregnancy benefits and certain benefits that fell under what was called restricted scope Medi-Cal, or Medicaid, as it's called in other states, the same program. Well, we're eliminating that scope restriction in California. So the same coverage that's available to California residents who are here legally, who were born here, if they are low income, and right now that's 14.6 million Californians. More than a third of the state is on Medi-Cal. And there's a limited number of providers. What they've done is they've decided to expand this same identical coverage to people who have just come over the border. They can sign up for this same full scope medical health insurance for low-income people. And not only is it expensive, but because there are a limited number of providers who will accept Medi-Cal patients, and providers will accept a limited number of Medi-Cal patients even if they do, the wait to see a doctor gets longer and longer the more people you have on this program. This last tranche of undocumented immigrants, people who are 26 through 45, I think it is, or 26 through 49, were added most recently. That is going to cost about $6.5 billion a year out of the California General Fund. And the thing about that $6.5 billion estimate is that nobody really knows how much it's going to cost. So here's how this works. Someone signs up for it, they have full medical insurance, whatever they need, without limitation, they are entitled to have. And as many people as choose to come into the country illegally and sign up for it are entitled to it. So they can say $6.5 billion, but they have no idea what it's going to cost. No one knows. It depends entirely on who signs up for it, how many people sign up for it, and what they need after they do sign up for it. Originally, this was extended by Governor Jerry Brown and the legislature to children up to the age of, I think, through 18. And then there was another expansion, 19 through 25, I think it was. And then there was another expansion, people 50 and older, all undocumented, entitled to full scope Medi-Cal. Now they've added this latest group. As of last fall, this was signed into law. And now this latest group is entitled, so that's people between 26 and 49. That's estimated to be about 750,000 people, but nobody really knows. They're entitled to sign up for full scope Medi-Cal health insurance, just like a third of the people who live in California. I think it's a disservice to the Californians who are on the program. It's a disservice to the doctors and healthcare providers who are trying to accommodate this population. Giving someone an insurance card is not the same as giving them medical care. You have to have providers who give medical care, and it has to be paid for out of the California budget. And the California budget is in deficit, and so it's going forward. Any other cuts that are made to the budget, I think it's a bit corrosive in our society to do this, because now you're cutting someone's program somewhere. It doesn't have to be that way.
If you haven't checked out CaliforniaInsider.com, we highly recommend you do that now, because we're going to have a lot of news and videos there. And on top of what we have there right now, we are building a really big platform to cover what's happening in California, so you can be informed. We're going to have more shows, more videos from all aspects of life in California. Go to CaliforniaInsider.com and we'll see you there.